Hi, I'm Ashan Sattar. I'm a neurointerventionalist specialist. I repair brain aneurysms and I do mechanical thrombectomy that entails pulling blood clots out of the brain. An ischemic stroke is the most common kind of stroke, which happens when a blood clot makes its way all the way in one of the major vessels of the brain or a smaller vessel and impairs blood supply to a certain part of the brain that manifests with sudden loss of a neurological function. A hemorrhagic kind of stroke is a bleeding kind of stroke that can typically happen from a lot of reasons. Most common could be high blood pressure, or it could be trauma. Very frequently we see hemorrhagic kind of stroke from ruptured brain aneurysms as well. A stroke is a sudden loss of a neurological function. Somebody is normal 1 minute and all of a sudden they notice one side of the body is weak and they lose sensation on one side of the body. It's always sudden in onset, and typically it's worse at onset and gets better over time. Other common symptoms of stroke include numbness towards one side of the body, inability to talk, meaning you can think of the words but unable to say those words out loud, and that can affect that's secondary to language center being affected on the left side of the brain. Other times, inability to speak clearly, like you have marbles in your mouth, you cannot enunciate the words correctly, and people have trouble understanding. So, sudden loss of acute neurological deficit, I consider it as a stroke. Once the stroke has started, could be from any reason. Most commonly, if a blood clot made its way all the way in the brain and part of the brain is not getting enough blood supply, that tissue starts to die. This has been studied. Patients lose about 2 million neurons a minute. So every step has to be made, or every effort has to be made to ensure that patients end up in the right hospital where they get the right treatments to revascularize those blood vessels, since there is very critical brain loss happening every minute lost. The first thing is to call 911 if somebody is having a stroke. In the interim, while the EMS is on their way, you can try to gather some information, like when was the time the patient was last seen normal, or when was the time the stroke had an onset. A few times patients can't tell you because they are unable to talk. Stroke victims cannot talk. So if the patient is unable to tell us when the stroke started, try to gather that information. And if you can gather what meds are they on, that can be really helpful too. But calling 911 immediately is the right thing.